And we're going to begin with growing concerns about a new variant of the coronavirus first discovered earlier this month in South Africa and since turning up in Belgium, Israel, even Hong Kong. The World Health Organization at an emergency meeting today gave the highly transmissible variant of concern, as they call it, a name, Omicron. Scientists are now working around the clock to learn if it is more dangerous than the Delta variant, which of course sparked a fourth wave of global cases and fatalities earlier this year. That possibility sent shockwaves through Wall Street. The Dow suffered its worst day of the year, plunging more than 900 points, or about 2.5%. And the S&P 500 and NASDAQ also dropped by more than 2%. Well, this afternoon, the United States responded, joining a growing list of nations in Europe and Asia restricting travel from South Africa and 7 other countries in that region. And tonight, Moderna and Pfizer say they can adjust their vaccines if and when needed. Johnson & Johnson, meanwhile, is already testing its vaccine effectiveness against the variant. CBS's Debora Patta is going to lead off our coverage tonight from Johannesburg.
Once again, South Africa has become ground zero for a new variant. Nearly a year ago, it discovered the Beta variant. Now it's detected one that has over 30 mutations, the biggest jump in the virus's evolution since the pandemic began. And what concerns scientists is whether the new variant, named Omicron, is more transmissible than other strains or vaccine resistant. But at the Texas Children's Hospital Center for Vaccine Development, Dr. Peter Hotez says there is no need to panic at this point.
The key is knowing how transmissible and whether it has that ability to outcompete Delta. And that bar is high.
The virus was first detected after a spike in cases near Johannesburg. Numbers are still low, but they more than doubled in 2 days. And it's mostly been found in young adults, a group with a low vaccination rate. Scientists are now working around the clock to find answers, but a jittery world is not waiting for them. International visitors are scrambling to get home as the US joins countries in Europe and Asia who've already closed their doors to South Africa. The world has been here before. The highly transmissible Delta variant, first identified in India in December last year, quickly spread to become the dominant strain in a matter of months, forcing more lockdowns last summer. Dr. Hotez cautions against overreacting.
There's really very little that we can do to actually stop the virus via travel restrictions. I think it's highly likely that this new variant is already pretty widespread.
South African scientists tell us they will know how effective the vaccines are against the new variant over the next 14 days. And Pfizer says, if necessary, it can adapt its vaccine within 6 weeks. Tony?
That's an important if. Thank you, Deborah.